I believe information technology plays a key role in the integration of the electronic medical record and the evolution of the next generation of practicing medicine. As evidenced by most of the hospitals in the country now of implementing an EMR and using that EMR to practice medicine, the IT plays an important role in making sure that we're digitizing America and that all of this information for patients is all captured and available for clinicians to use. As a whole, I would say that hospitals are doing much better with the implementation of information technology. We're kind of over the hump now. The clinical community does believe that it's the right thing to do. So I think we're past some of the reticence that the community had for implementation, and they're really kind of getting down to business and implementing these medical records. Some of the hurdles are this is very complex technology, and it requires, first of all, buy-in by the clinical community and the entire hospital administration. It really is as much effort as building a brand new hospital. And in fact, what they're doing is really building a foundation for the way medicine is now practiced electronically. It literally touches every workflow. So you can imagine something that's that massive of a change requires study, it requires tenacity, and it requires commitment by the entire hospital system to implement effectively. But they are getting it. They're starting to implement much more. They're implementing more quickly than they have in the past, and it's working quite well. High availability is really important now. If you think about it, now we're practicing medicine electronically, and it's critical that that information be available 24/7 by 365. What we're seeing is a need also for the clinical community to have a go-to phone number to talk to, a service desk of sorts that helps the clinical community navigate through sometimes these very complex softwares. And we're seeing that being that's one of the things I think that's been a challenge is hospitals will sometimes forget that at the end of all this, the clinicians need to have assistance working with this software. The high availability part of it, though, to get back to that, it's extremely important that the system be there, be reliable, and be 100% available for the clinical community to use. I would think that the information technology, what I've observed is that it is very good in the acute care setting. In other words, within a hospital, the electronic medical record is complete. However, once you get outside the acute care setting and try into the convergence of what's going on in the ambulatory setting with the acute care setting, the technology is not quite there. Meaning that there's not a bidirectional flow of information always between the ambulatory sites and the acute care sites. So I think the next big development is a more robust implementation of the health information exchange. The clinical community, rightfully so now, has seen the capabilities of what electronic medical record can do for them. They want seamless integration between their practice and their hospital that they practice, where they practice. So the information technology is currently today is challenged there. That is an ongoing area of improvement, but it's not quite yet where there is seamless information, especially from disparate systems. The gaps that exist today is that the disparate systems do not talk to each other. So a clinician in his office may have one set of software that he's using, go to the hospital where he or she has an entirely other set of software to use, and the integration between those two separate pieces of software does not yet exist seamlessly. So that's what the clinical community, I believe, is now asking for. They want a seamless transition between their practice and the acute care setting, the hospital. They want to be able to see information flow bidirectionally between those two systems.